Nothing really prepares you for that moment.
Coming up today, a new mom notices a strange rash and changes in her breast just months after having a baby. What doctors discovered next was an aggressive form of breast cancer. Good morning, I'm Jessica Lovell. We are live from the Dolph C. Simons Jr. Family Broadcast Studio at Olathe Hospital this morning. Welcome to the Morning Medical Update. Today we are sharing the story of a young mom who was diagnosed with breast cancer just months after having a new baby. She wants other women to know about the warning signs and what they should never ignore. Courtney Flannigan had a picture-perfect life, a new home to grow into, until in a moment, it all seemed to come crashing down around her.
Nothing really prepares you for that moment.
At just 34, Courtney was diagnosed with stage 3 triple-negative inflammatory breast cancer.
As a mother, what does this mean for my children? Am I going to be there to take care of them? Am I going to be there to see them grow up?
Her second son was just 4 months old when Courtney noticed changes in her breasts.
I had noticed like a red kind of blotchy rash. It appeared 1 month and then went away and came back like the following month, and also noticed a little bit of, they call it like orange peel skin, a little bit like skin thickening, like a little dimpling.
A mammogram and biopsy confirmed the cancer, and Courtney sought treatment right away.
I had proactively reached out to KU because I knew, right, if it was cancer, like KU is the place to go.
The University of Kansas Cancer Center is where she started on chemotherapy, then immunotherapy and radiation treatment. Later, she had a mastectomy and a lymphatic bypass to treat the breast cancer. It was a lot as a new mom.
I had a crazy rash from the reaction to the drug, and then I was losing my hair, and so then I was on steroids because of that rash, so then I was getting puffy and gaining weight, and it was just like the physical changes were a lot. And I think too, it's more than just hair, right? Like it represents, you look in the mirror and like you look sick or you don't look like yourself. I feel like if anything, it's made me kind of appreciate the moment I'm currently in, right?
And right now, that moment is cancer-free.
Trying to live and be present, especially for my kids.
And recently, she and her husband celebrated their 10th anniversary.
It was honestly kind of great to have some time alone and reflect on everything. We really put our wedding vows to the test, yeah. Like in sickness and in health this past year.
And we are so glad that Courtney is here with us today. So good to see you.
Yeah, thank you. Good to be here.
We also have nurse navigator Mackenzie Seelbach with us and breast surgical oncologist Dr. Jamie Wagner. Both great to have both you ladies here.
Thank you. It's great to be here. Thank you.
Courtney, you were a new mom, 4-month-old baby. Mm-hmm. Such an exciting time. Lots of changes to the body, as we all know. We're all moms sitting here at this table, so we know what that's like in those months after having a baby. But beside the changes to the skin on your breasts, what kind of gave it away that you knew you need to get something checked out?
Yeah, so I had been breastfeeding, and obviously, like, there's a lot of changes happening there. So I never noticed like a lump per se. I noticed the skin changes, so a rash, which is not uncommon for my fair, sensitive skin. But I think just like the recurrence of the rash, and then kind of, I don't know, I had like a gut feeling to give myself a self-exam and noticed some other more like skin changes and nipple changes to where I was like, something is off. And so definitely had the gut instinct to, honestly, I took it to Google, and Dr. Google is scary, and the hypochondriectomy was like, maybe we need to get this checked out. Let's get in to our doctor ASAP, and I'm glad I did.
That's super smart that you were following those changes, and you just followed that gut instinct. You sprung into action pretty quickly. Tell us what steps you took as you started to get that checked out.
Yeah, so first I saw my OBGYN because I was postpartum and had thought it was mastitis or something breastfeeding related. Went in like the same week for a checkup, and You know, she wasn't super concerned, but was like, let's just send you in for a mammogram just to be sure. So I was able to get that scheduled a few days later. Went in for my mammogram, and they did an ultrasound at the same time because they obviously noticed something concerning there. And then I remember the radiologist came in and was like, hey, we need to get you in for a biopsy ASAP. Like, I'm really concerned with what I've seen. This is not something we want to delay. Can you come in like next week to get our first available for a biopsy? And so I did that. At the same time, was working with my OBGYN still, and she was trying to get me connected with a breast surgeon in the situation that it was cancer, but also if it wasn't cancer. So I had kind of met with that doctor initially to kind of move things on, and we really were just kind of waiting on that biopsy. Had the biopsy, and then of course it's the waiting game, like the worst, you know, week just waiting for the results. During that time I had reached out to KU, kind of was doing some research of my own of like, okay, she thought it was probably inflammatory breast cancer, which again, Dr. Google's a very scary place to be. But I had reached out to KU and had been doing some research as far as like other national kind of cancer centers that specialize in inflammatory breast cancer. And I had been in touch with a nurse navigator at KU and was kind of got me set up, right? Like tentative appointments was really like, we'll hold until we get the confirmation from your biopsy. But it was nice as someone who is very like a doer to have a plan in place at least. So
so you were kind of getting your ducks in a row and knew where you wanted to go in the event that you got the news, which you did. And Dr. Wagner, it sounds like from the moment that she started noticing these symptoms, it was like she was doing everything right up until she found you.
Yep, 100% right. And you know, I've said with many of the different patients that we've been with, my take-home message is always be your own advocate, and just know your body, know what changes about your body, and that's where Courtney could not have been like the better poster child for what I preach all the time. So she was very proactive. Yes, Dr. Google is very scary.
Other than going down the Google rabbit hole, she did everything right.
Well, you know, but if that gave her enough alarm to say, I need to at least pursue these changes, that's okay.
And she was coming for you because she knew she wanted to come to KU. And you had said that when we spoke, that you said you knew you wanted to come to the cancer center.
Yeah, I had heard recommendations from, honestly, it was mostly like friends whose mothers have gone through this experience, but had several recommendations, even like friends within the KU system. We kind of been reaching out like, hey, who's the best? Who do we need to see? How can we get scheduled with these people? And so in my mind, I had kind of a team that I wanted to see. And so I was like very pleasantly surprised that when I was working with the nurse navigator that I was able to build my care team and like quickly, and they were all able to meet like at that first initial appointment.
Let's bring in Mackenzie. So tell us what the role of a nurse navigator is and how you help patients literally navigate a cancer diagnosis.
Yeah, so, you know, usually we're the first point of contact for patients that are newly diagnosed, you know, with breast cancer. And so I really feel my role up front is just making sure that they're doing okay. You know, the news is so devastating. Like Courtney said, the waiting game is so hard. And so what can I do in that moment to help make it a little bit easier for her, talking her through the diagnosis, educating her as much as possible, and staying off of Google. What resources do we have, you know, moving forward? And, you know, as we know, like being a mom is always at the forefront of our brain. So as Courtney was diagnosed, you know, I'm sure that her first thoughts were children. What resources do we have for kids? And we have a lot of them. And so bringing those things through and then just making sure we're getting her through the door as quickly and efficiently as possible.
And that sounds like that's exactly how that went. I want to talk about the mammogram because so many advancements when it comes to imaging. So how important is advanced imaging when it comes to help detecting breast cancer?
Oh, I mean, it's revolutionized where we are today and why we have the opportunity to diagnose at very early stages, and we know survival is always better, but also some nuances like what Courtney's situation is. These newer advances have just truly changed how and what we can do for patients.
she was diagnosed with triple negative inflammatory breast cancer. When we hear the inflammatory word put in there, what does that mean?
That's an important distinction. It's actually a clinical diagnosis. That's the big thing. There are very key components that we know make an inflammatory breast cancer, which inflammatory breast cancers actually make up only about 1 to 5% of all breast cancers that we see. So it's a very small patient population of all of our breast cancer patients. Specifically, often there's not even a mass. And that's what can be very challenging, right? And that's, again, I cannot give enough kudos to Courtney on her very close observation. It's a breast cancer that's very aggressive, spreads very quickly. We see it definitely kind of a pathognomonic. It's less than 6 months, you see rapid progression. The most of those are going to be either a triple negative or HER2 positive breast cancer, so very specific biology, are more biologically faster moving types of cancers. Hallmark things are, as she was describing, changes of the skin, it becoming red. She described it as a rash. It may not necessarily look like a rash, like you're having an allergic reaction, but the skin will become red and very edematous, so lots of swelling. It may feel globally firm or in a specific area firm. And as she described it, it looked like an orange peel. That is a pathognomonic, what we call poto orange, and it looks like an orange peel. So the pores will get dilated, and that area of the breast might become firm, leathery feeling. And so those are really the hallmarks of how we diagnose this. And then the other aspect is what we call dermal lymphatic invasion. So the lymphatic channels within the dermis, within your skin, which is what's causing these skin changes, gets infiltrated with the cancer cells. Sometimes people misdiagnose it because they'll do a skin punch biopsy, so test that skin for the cancer. And if it's negative, they think, oh, it's not inflammatory breast cancer. But that's not true. It is truly a clinical diagnosis. Her presentation and being such an amazing historian really is what allowed us to be able to get a very good diagnosis for her.
I cannot tell you how happy I am we're talking about this morning, because we are so used to talking about breast cancer when it comes to finding a lump or detecting it through a mammogram and seeing something or feeling something, and then that you found it during a time when you were, having a baby, postpartum and breastfeeding, where you could have missed something so easily. I'm just so glad you're here. So tell me about the treatment path. When you met with Courtney, you got to work. What was that like? Yeah,
that's actually another really important part about triple negative breast cancer is it takes the team, right? So it's a entire multimodality type of treatment where we are going to have chemotherapy is going to be involved, surgery, and radiation. We want to always start with chemotherapy. In part, we want to know how well it's going to work, and that's truly the test, is when we are seeing the patients that have these type of significant changes in the breast, when they respond, and they can actually respond, especially with more current therapies, immunotherapy, like for triple negative breast cancers, that breast can start to change just within a few cycles of treatment, and that's what we want to see. Otherwise, do we need to pivot on maybe what systemic therapy agents that we're providing? And then that would be followed by surgery, and surgery for this specific type of cancer is the standard of care is what we call modified radical mastectomy. It's a mastectomy. It's removing of all the lymph nodes, because unfortunately 90% of patients with inflammatory breast cancer upon presentation will already have cancer in their lymph nodes. And so we need to remove all of those lymph nodes at surgery. That's really the standard of care. As much as we've talked and continue to talk about how can we do less lymph node surgery, this is not a population of patients with this diagnosis that's appropriate at this time. And then we also, because it's in that skin, we can't do reconstruction at that same time. Reconstruction, it's not that it can't be done, but we're going to delay that because we need to remove as much of that affected skin. And then that is followed ultimately by radiation.
How did you do through treatment? And again, you're doing this with 2 little boys at home. How did you manage all that?
It was hard. I feel like I had a really good support team through my family, my church community, my employer. Everyone was very supportive during that time, so I was able to kind of focus on resting. I obviously had the physical issues with chemo, right? Like I lost my hair and I gained weight, and at one point I was hospitalized from a reaction to one of the drugs. But once I kind of got through that, I think it felt like there was a little bit of light at the end of the tunnel, and then surgery, like healing actually went really well, and then radiation was a whole another because I had the inflammatory, they really targeted the skin and went really hard on radiation. I had a very aggressive radiation plan, and so by the end my skin was very raw and it was in bad shape, but even now, looking back, oh wow, it heals. Our bodies are amazing. So it's been good to have the bounce back and see healing and all of that.
Mackenzie, as a nurse navigator, many patients say that the diagnosis is the most overwhelming moment, but how do you help patients and their families process in that overwhelming moment? Because oftentimes, especially if someone's referred to the cancer center, you're often the very first point of contact that they have with the cancer center, and you're very important to them. That voice on the other line is a very important person. You leave a lasting impression with many of our patients. So how do you have those conversations?
Yeah, that's a good question. It's you're right. We are the first point of contact, and sometimes patients haven't even had a chance to process what they're going through. My big thing and what I try to do as a navigator is meet them where they are. You can tell when you're on the phone with somebody what they need, and so a huge part of our job is being able to provide these resources and supportive care and letting them know that we're here. Even though we're not necessarily following them throughout their whole journey, as a navigator, I am here to answer your questions, to help get you through this. We're going to do the best that we can to get you on the other side of it. And so I think it's really important to gauge what people need. Everyone's a little bit different. Everyone's diagnosis is a little bit different. Some people do better with more information and some do better with less. And so really trying to figure that out and just listen and be an advocate. I think that's kind of the biggest part.
I think that sounds about right. You're not a call center. You are there to hear. Dr. Wagner, I know I'm going to give you a chance to talk about how important these navigators are, because you're right. They're there to, some patients I would imagine call and are ready to tackle this, and then some are so scared and need to hear a comforting voice on the other end of the line.
Absolutely. And I work very closely with our navigation team and could not be more blessed to have the group of nurse navigators that we have. We're also fortunate that we have disease site-specific navigators. And I think that's important because no two cancers feel the same or have the same emotional, psychological impact. And all of our navigators are specialized in breast. So that's really an asset to patients because just like what Mackenzie was describing, they know what the needs are that are unique to this particular type of cancer, but they are the front line. When patients are calling in, it's the unknown that causes that fear. And they truly are able to help kind of harness that, provide them the right level of education to kind of get them through until they see the providers to better understand their diagnosis at a deeper level and then what treatment's associated with that.
Well, be sure to ask your questions. Use the chat on YouTube or Facebook. You can also email the Medical News Network. That information is there on your screen. Courtney, you talked in the story about losing your hair. That was a tough time. You said it's just part of what you look like when you look in the mirror, and you didn't want to look sick. What was the hardest part and challenging part, physically and emotionally, for you?
Yeah, I think just looking in the mirror and not recognizing the person I was in that moment. I have 2 toddlers now, but kids are very curious and innocent, and I was just really concerned that my son would see me as being sick, and I didn't want him to be affected throughout all of this. But now I have really sweet memories with him, and we joke that my 4-month-old had more hair than I did at one point, and who's gonna grow it out faster. And my older son to try on my wigs. So it's fun and funny now to look back on, but at the time I was just really concerned with how it would affect them and their perception of me, or just, I didn't want their day-to-day to be affected because they're kids and they should just be having fun and playing.
Yeah, Mackenzie, Courtney's a young mom. How important is it, that support, a family, and making sure that she's got that, not just here at the the cancer center, but back at home too.
Oh my gosh, it is, in my opinion, one of the most important things. You know, I can tell you as a mom of 2 young kids that just being a mom is hard. It's difficult, and we need family for that. And then throwing something like this on top of it, I mean, you have got to have that support, and that's something we've tried to provide to you, but you need it outside of here too. I mean, it definitely takes a village, and in situations like this, even more than that.
Dr. Wagner, we talked about this earlier. Courtney had chemotherapy, radiation, and then that surgery, that radical mastectomy, and that a lot of times reconstruction will come at the time of the mastectomy, all in one, but this needed to wait, and that's coming up very soon.
Yes.
In about a month. But tell us why the wait, explain that again, and then what reconstruction, what that process looks like now.
Yeah. Well, the sad reality of inflammatory breast cancer is that a lot of these patients will recur, and they recur quickly. And if we would be in the process of reconstruction, that could interfere with them getting the timely treatment that's life-saving. Reconstruction, it's an important part of this journey. It psychologically has such a huge impact on a lot of women to regain their body form, but none of that matters if we can't get to survival. And so we want to have an appropriate monitoring period of what was the response to treatment, and then get us far enough out that it wouldn't potentially interfere with any type of treatment, life-saving treatment that we need. Additionally, as I had described before, because this impacts the skin, we also want to remove that skin. And the hallmark of doing immediate reconstruction is saving the skin. As I described to patients, taking a pillow out of a pillowcase, because I'm going to save all the skin. Sometimes we can even save the nipple and areola, and we do that frequently. And then really start that reconstruction process. But that's the key element, is we're saving all of that skin. And we can't appropriately save that with this type of process.
So what will this part of the journey mean for you, this reconstruction, finally?
Yeah, so it's kind of exciting to put a pin in this chapter, move on and be done. I think it will wrap up, hopefully, my breast cancer journey, and get to moving towards just like a little bit of normalcy. But it's also been crazy kind of to reflect on the last year and a half of treatment, and just how far we've come and how much our lives have changed since that diagnosis. So yeah.
You said this experience tested your wedding vows, as you mentioned. You were able to celebrate your 10-year anniversary. How did this change your relationship with your husband?
Honestly, it made it stronger. He showed up for me in ways I can't even comprehend, and I know he was also having a hard time watching me go through that, but he stepped up to take care of the kids and kind of fulfill some of the household duties that I was not able to take on at the time. And so honestly, yeah, it's made us even stronger and closer, and yeah, I have just so much admiration for him.
I bet you do. I'm sure he feels the same about you. And you have talked about the care that you've received at the Cancer Center and your team, and how grateful that you have been, and you and your husband have actually made a sizable, to say the least, a sizable donation to the Cancer Center after you finished your treatment. You wanted to make sure that that gift would support the breast cancer program, and it would establish a fund in your family's name that will support the growth and advancement of the breast cancer program under Dr. Wagner's leadership. So we want to thank you. I'm sure Dr. Wagner would like to thank you. And what does this mean to you, Dr. Wagner, and how does it help future patients?
Unfortunately, not in front of a camera, we've had the opportunity to talk about this because it kind of gives me chills as I hear you say it, because I am so grateful. It is such an incredible gift of self that they are giving, and she's already given so much, I think, a gift of self of making it through this treatment, just talking about her story, and that's going to pay forward to other women, but this is going to pay forward in a very different way. It just gives us opportunities through the breast program. There's some key elements that we have grown this program tremendously in the last, in particular, 13, 14 years here, but we're not done yet. And that is what their generosity is really going to provide us, is there's areas that we want to continue to expand access, expand support services. And this is truly, I think, the beginning of a new chapter of where we will be able to go for the breast program.
Why was this so important for you and your husband to do?
Yeah, obviously we were directly impacted. We benefited from the care that we got here, but we are very passionate about Kansas City, and we want to just like expand the care and the opportunity. Like, you know, I think it's important for Kansas Cityans to be able to get elite top care. Just because we're in Kansas City doesn't mean we shouldn't have access to that. So however we could bring the resources that some other national hospitals have, like let's help, let's bring it here so that people don't have to travel. And I know KU serves beyond just the Kansas City area. People do travel here, and so just making it like a top destination, like we want to support that because we really did benefit, and it was so reassuring to know that we were getting good care when we were here, and that I'm sitting here today because of it.
Well, we're so glad you are. We want to get to some quick questions and comments from our viewers this morning. Jeremy says, extra kudos to Courtney for recognizing something was off. So, and just thank you for sharing your story and your symptoms. Question from Tim. If men notice a rash or skin change on their breasts that won't go away, would that be a sign of breast cancer in men?
It could be.
Could be.
Yeah. I mean, that's part of, I think, the problem. We forget that men can get breast cancer. It's not the common cancer that men get, but absolutely men get breast cancer. And if they start identifying those subtle changes or feel something that is different, no different than I tell women to know their bodies, I advocate that men know theirs, and their breast is part of that. And if they start seeing a small change, they should really get it checked out. Oftentimes, male breast cancers, although more favorable types of cancers, we find them more advanced because they write it off. So no different. If we can find those earlier, less treatment, better outcomes.
Mike asks, how often does breast cancer happen to women in their 30s?
So, great question. And actually, I think we just had a previous segment on young women and breast cancer, because although women's breast cancer, 1 in 8 women get breast cancer, most common is their 50s, 60s, and 70s. But we are starting to see an increased incidence in women in their 30s and 40s. There's a lot of things that we know that are probably contributing to that, including women are not having as many children. And we know that there's a relationship with that. Often women are waiting until later because of the changes in the career pursuit by a lot of women they put off, and having children at a later age also has an impact on that. And then of course our environment, right? We're filled with a lot of preservatives now. Obesity has a tie to that. So it's just the change of all aspects of women's lifestyles.
And last question is from Jeremy. Since this type of cancer is more focused on spreading instead of making a lump, is it easier for a typical doctor to miss? You're not a typical doctor. So is it easier?
I'm going to take that I'm not a typical doctor. I don't know if that was meant as a compliment, but I'm going to take it.
You're not a typical doctor.
That's for sure. You know, this is a very challenging diagnosis. So when patients may present to primary care doctors, I would say the most common thing that we see is they think it's an infection, like a mastitis, and they'll put patients on an antibiotic. And to be honest, there isn't anything necessarily wrong with that, as long as we don't go through 3 different rounds of antibiotics over the course of 2 to 3 months before we say, whoa, that's not getting better, and elevating it. Yeah.
Mackenzie, thank you so much for being here with us today. What's the big takeaway from our conversation?
Oh, I'm just so glad we talked about this today, because like you said earlier, you know, I do think that we typically focus on find a lump, get it checked out, and it's so important to just pay attention to your changes in your breast. You know, I think get connected with us. You know, we have a clinic that we can get you connected with a navigator, and we can help triage those symptoms as well, but don't wait. Get it checked out if you notice something.
Courtney, what's the big takeaway from your personal story?
Yeah, I think just kind of trusting your gut and advocating for yourself along the way. For me, it was I needed to find the best care, and I didn't want to, you know, settle. So I'm glad that I did that. So I would, just recommend advocating for yourself and just knowing your body and trusting when you think something's off.
Thank you for sharing with us today. Dr. Wagner, wrap us up. What's the big takeaway?
Well, actually, maybe a little bit of combination just of what they're both saying, but really to extend what Mackenzie was commenting on is you don't have to have cancer to be at the University of Kansas Cancer Center. We have high-risk programs. We have access when there is something abnormal, what she was referencing. We have an undiagnosed clinic that is part of our breast surgical oncology team, provides early access. We can get the right imaging very quickly. And oftentimes, actually, patients get from imaging to biopsy to a treating provider faster through that process. And so if you've got a concern, call. We'll get you in the right place. It's all about the right place, right time, right? And so that is what the hallmark, I think, of our program is. So just call us, and we're accessible. We have a lot of resources. I'm here because I believe in Kansas City. Just like what Courtney, I know, has a passion for. That's why I continue to stay and want to develop new programs, is for the people that we serve. It's serving purpose for others. And that's what this entire team is built with. Our navigators, that's why they show up every day. So let us help you.
Well, thank you for the work that you continue to do, all of you. Thank you to all of our guests for being with us. Thanks to our viewers for being with us today. Coming up on Monday, a car crash changed one man's life in ways he never expected. What doctors discovered during a routine scan after that accident, and how an aggressive cancer diagnosis led to life-saving treatment and an incredible comeback.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.